All right, thank you, Ms. V. We appreciate that. First of all, let me thank our guests who are here today, Dr. Travis Gales, as always, Ms. Sylvia Kinch, we thank you. And we're also joined by our procurement director, Ash Shetty, as well as some of his staff, Greg Renew, as well as Bethany. And we want to thank everyone for joining us. We have a lot of information to go over today. There's been a lot of new updates this week, so we're going to get right into it. I do want to provide a grant update, two grant updates from our partners over at EDC. The first one being the restaurant relief program that they're going to be operating. Their grant program goes in front of council for it to be approved on this upcoming Tuesday, which I believe is May the 18th. Once it is approved, applications for that will open on the following Wednesday. They are also working on a nonprofit grant program, which I think you've heard me speak about, and we haven't had much detail, but I do want to provide some details on it now, as it is definitely going to help our grant partners. As you may remember, the Maryland General Assembly passed the Relief Act of 2021 this past session, and part of it was a Department of Housing and Community Development $20 million grant program to support the work of local nonprofits throughout the state. We, as Montgomery County, got $3.4 million of that allocated to our Economic Development Corporation to be the administrator of that process. This is for the nonprofits in Montgomery County. There will be competitively selected $5,000, $10,000, and $15,000 grants that will be awarded to nonprofits that align with the intent to assist the community organizations that create and sustain jobs. There have been 4 identified priorities, and they are minority entrepreneurship, STEM education, research and innovation development, and small-scale manufacturing. And consequently, those 4 areas will be given a priority in the selection process that will accompany this grant program. The application for these grants must be submitted to EDC by 5 p.m. on Friday, July 2nd, and the funds will be distributed no later than September 1st of 2021. And the nonprofits must make use of the funds by the end of the calendar year, December 31st of 2021. EDC will be putting out more information on this grant program, so please stay tuned to their website. They are excited about this opportunity. They have administered several different grant programs for the community, and this one is going to be no different. It should be impactful. It should be extremely helpful to those who are still in need as we continue to climb out of the pandemic distress. And we look forward to it and helping you and making sure that you have all your questions answered as much as possible. Now, again, speaking about our public health, and I wanted to welcome Dr. Travis Gales and his beard. This is the first time that we have seen him with his facial hair, and it looks great, my friend. There has been a lot of information that has gone on this week, and I don't need to tell that to him. He talks and breathes this every single day. I believe that the update he is going to give is going to be robust, and I know that there are quite a few questions, so we will get right to it and let him give an update. We'll get to some questions and answers, and we'll get going from there. Dr. Gales, welcome and thank you, and we appreciate your time as always in advance.
Thank you, Jerome, and good afternoon to all that are on the call. And thank you all for everything that you all are doing collectively from the county team as well as our community team, because it truly is a partnership in terms of how we're able to be where we are in terms of a launch point to, I think, moving forward in terms of reopening things. To take a step back, yes, Jerome is right. I do not usually sport a beard. Trying something different, maybe. The challenge is that I will say that the beard today is a lot grayer than what it was in February of 2020, as my niece likes to point out. But in all seriousness, there have been a lot of updates since I believe we last spoke with you all. I'll try to just throw out some bullet points and then, answer any questions that you all may have as best as we can. I think the most important thing to note is that over the course of the last several months, when we did have more restrictions in place compared to the state, we saw our levels of community transmission stay stable and actually take a decrease in comparison to the rest of the state. And what that translates into, in terms of numbers is, for example, our case rate stayed, I think the highest it bumped up to was 12. And in comparison to some of the larger areas, other larger areas in the state of Maryland, for example, Baltimore City's case rate ballooned over 30, and I think Baltimore County was in a similar area. And just as a point of comparison, if our numbers had done that, if we've gone from 9 to 12 to over 30, we're talking about 300 or so additional cases on a daily basis. And so you can imagine if we were seeing that volume, what that would translate into potential hospitalizations and to a lesser degree, potential COVID fatalities. And so I know that there has been a lot of consternation around taking a more restrictive approach, but from a public health perspective, in terms of preventing cases, preventing hospitalizations, and preventing fatalities, those actions did just that. Now, all of you all, though, we recognize that in providing public health guidance, given that that is our charge to minimize disease transmission, we know that there are side effects to those rules and those provisions that are put forward in terms of the economic impact, the impact on schools, the impact on a host of different things. And hence, we are excited to be able to move forward in an area where we are seeing much lower community transmission levels. And the new metric that was added to reopening was the percentage of our residents covered by vaccinations and protected by vaccines. And so that was something else that we added new to our reopening metrics. And the state has actually also done so this week by including a 70% vaccination rate as a condition of moving forward in terms of the governor's reopening ideas. And part of that is we set up 3 phases. We set the first one, which we met fairly quickly, which was 50% of our residents receiving at least 1 dose. The second phase would begin when 60% of our residents received at least 1 dose, and I believe we're knocking on that door. We're in the 58% range. I do expect that number to go up at a faster clip now that we are being able to vaccinate 12 to 15-year-olds. Unfortunately, we saw a drop in community demand over the last 3 weeks in terms of folks coming in, and so we did not hit the 60% target as quickly as we thought originally, but I am confident that given this new influx of eligible folks that number will increase quicker than it has over the last several weeks. And then the last parameter that we set forth was a 50% of our entire population being fully vaccinated. Fully vaccinated being defined as receiving 2 doses of the 2-dose regimen or 1 dose of the Johnson & Johnson. And then 2 weeks following that date, which I anticipate actually may happen today based upon the CDC's projections, those individuals would achieve fully vaccinated status per the data. And then we would move forward in terms of reopening without capacity restrictions and aligning with where the state is in terms of respect of other capacity limits related to physical distancing, et cetera. So we've made progress in that area. Just to give you a hint of how we're moving forward with young people, for example, yesterday was the first day that we administered doses to the 12 and 15-year-olds as part of the county apparatus. We administered over 3,300 first doses just as a part of the county clinics, and 2,700 of those were 12 to 15-year-olds. And we already had this morning on schedule 2,700 new people in the 12 to 15-year-old group who were scheduled, and that doesn't include others who will walk up to sites, which now all of our sites are walk-up eligible. So again, it's important to note because all of these doses are counting to that first dose category, which has lagged a little bit over the last several weeks. Now, to shift to other areas, obviously yesterday there was an announcement from the CDC in relation to the need to wear face coverings. And let me be clear, even though there has been, what's the best way to put it? There has been a lack of clarity, if you will, in terms of how people interpret that. Mm-hmm. The rules that they put out yesterday, or the guidance that they put out yesterday, was for individuals who are fully vaccinated. So when they're saying that masks don't need to be worn in outdoor settings or potentially not worn in indoor settings, that is specifically for individuals who have been fully vaccinated. Now, we're taking that into consideration, and I know the Board of Health will be voting on a resolution early next week to address that new guidance. And we also are, because part of the challenge is how do you distinguish between who's been vaccinated versus not? And so we're still encouraging folks, again, if you've not been vaccinated, to get vaccinated as quickly as you can, because there are ample opportunities available. But in the absence of that, to still wear face coverings, because you are at risk of contracting COVID-19. And we know that unvaccinated people still can be effective carriers and transmitters of the virus to other folks. So stay tuned for that updated guidance as that comes out. And also stay tuned as we move forward in terms of providing updates where we stand in terms of those numbers, those percentage of our residents who've been vaccinated that would trigger moving to those additional phases. I will say this is all lots of positive news, and literally we're talking about a matter of days, not weeks and not months. But the challenge remains is that even when we're talking about saying 60% received one dose or 50% are fully covered, that still leaves a lot of people out there who have not received a first dose and who are not fully vaccinated. And that is critical because virus is still in the community. And what we don't want to have happen is, and again, why we're encouraging as many people to get vaccinated as possible and not just saying, all right, we hit 60%, we hit 50%, we're done, is because there's lots of virus that could still be there. And we don't want to see an additional wave of cases, which would have to make us consider, walking back any of these provisions that have been put in place. So I will stop there. I know Sylvia is with us as well. I don't know if she had any additional pieces. I know Dr. Stoddard is unable to join us today, but happy to answer any questions that you all may have. Thank you.
Hi, I don't have anything additional really to add to what you say other than I know you indicated we might reach the 50% threshold today. That would be 50% of individuals in Montgomery County have received both vaccines or whatever, one vaccine if they got Johnson & Johnson. And that would mean that 2 weeks from today, if we actually reach that today, we would be aligned with the state. But waiting for that last 0.2%. From the CDC.
Okay, thank you, Ms. Kitch, and thank you, Dr. Gales. That was my first question, and thank you for answering it in advance. So that'll provide a lot of clarity because people are going to see us right at the 50% number, and they're going to say, okay, it's time to go. But there is a 2-week period because fully vaccinated does not occur until 2 weeks after you get that second dose. So that is why that 2-week period would be attached to that. You said you were working on the guidance that's going to come out soon, and I think it's safe to say that the areas where we can require might not be as vast, but we will be still recommending us to be more safer than not going forward in those areas we have opportunities, correct? Because that is part of probably that supports the safety message that you've been saying for the last year plus. So our update, I'm fully confident we'll be recommending that we continue to follow those phased-in approaches.
Yeah, and that's exactly correct. And I also want to make clear too is that even if there are provisions to say that certain groups don't have to wear them, there's also still a lot of folks who are saying they still will wear them in terms of their comfort level. And certain businesses may still have the opportunity, depending upon the type of interactions and the type of spacing and all those kinds of things, they may still have the opportunity to say, we still recommend or potentially enforce it for people wear face coverings in their particular venue, as well as putting forth parameters around physical distancing within their space, again, to promote safety in their interactions.
Okay. Absolutely. And when we do get to that phase 3 mark, and when the county follows the state, will the current social distancing requirements be removed as well? It says the state's new executive order removed that requirement, and it's now only a recommendation. So would you think we would follow the same thing with social distancing?
Yes.
Yeah.
We would. Okay. We would align with the state at that point.
Yep. There you go. All right. Sounds good. Next question is, have you heard or do you have any thoughts regarding on a county level or a state level regarding both the District of Columbia and Virginia and their plans to reopen coming mid-June with virtually no capacity and no social distancing?
Well, the only difference is that there have been time limits put on some of those dates. But if you actually look at the parameters within which they're reopening and kind of what we've proposed and what the state has proposed, they're pretty much identical. And in terms of, for example, the District of Columbia being, fully open, if you will, in mid-June, based upon, again, where our numbers are and where we speculate things are going, I think we will likely hit the 50% fully vaccinated threshold today or tomorrow, which is, as Ms. Kinch pointed out, again, we would hit phase 3 2 weeks from that date. And so 2 weeks from that right now, if we hit it today or tomorrow, is before the end of the month. So, we've been hesitant to put a time and a date on it, but more left that to the actual baselines and the goals. And the reason why we've taken that approach is because, again, getting to these numbers means that we're getting more people protected and covered, which ultimately means that as you open things up, and thereby you really are increasing the opportunities for people, again, to come into contact with others and potentially facilitate transmission of the virus, we're having higher percentages of people covered, which gives us a little bit more comfort and confidence that when we do open these things up more fully, that we can safely do that and not be hit with another wave of cases, so that we can all really truly move on with our lives and get into a post-COVID space.
Yes, that is the goal, absolutely. And we talk about the people who are fully vaccinated. We kind of touched on that a lot. I was in a meeting yesterday, and one of our partners discussed the breakthrough COVID numbers, the amount of people who have been vaccinated but still have contracted COVID after being vaccinated. Is there anywhere that tracks that percentage so we can put it in perspective so that people know that there is still a chance, even though you've been protected? And the point of being protected is to ensure that, going to being hospitalized or something much worse does not occur. But people, and I think the executive even said that on this call this morning, there are people out there who are contracting the virus after being vaccinated. I'm not sure if that number is out there or if people are talking about that enough.
I believe the CDC has that information on their webpage. And I think it's important to define breakthrough cases. There are a couple of different categories. So there have been a significantly small amount, like I think a handful of cases, and don't quote me on this because I don't have the exact number in front of me, for individuals who have been fully vaccinated, meaning that they got both doses or the one dose of Johnson & Johnson, and they've been 2 weeks post that period where they've achieved that maximum level of protection. I think there's been a few breakthrough cases in that situation. The second category of breakthrough cases, which we have seen more of, are individuals who are incompletely vaccinated. They've either received one dose, they've not received both doses, or they're still within that gray area of I've just received one shot and I've not achieved that maximum level of protection or immunity, if you will, to provide that key protection. And more of those breakthrough cases have been diagnosed within that area. Now, the third breakthrough category is not really a breakthrough category. It's more of we're still seeing COVID cases in people who aren't vaccinated. And when you look across the country, there are some places who are starting to see an uptick of hospitalizations and an uptick of ICU admissions. And the overwhelming constant theme between all those folks are they're not vaccinated.
Right.
So I give you that spectrum to show, again, why we're encouraging and emphasizing vaccines, and we're encouraging our residents to do it, and why we put in a metric to tie vaccine rates to our level of reopening. Because, again, that third category, who's not protected, who's not been vaccinated, they are the ones who are continuing to make up our new cases, and unfortunately, a good percentage of them are still ending up in the hospital and having complications with their illness.
And I think that's a very important point that we need to make sure that it continues to be out there. And just a reminder for everyone who's listening, if you have questions, please put them in the chat. I believe there's only a couple of questions there, one of which I see we have already answered. But the last question that I have that I had in writing was that we did hear that, with the younger residents now getting the vaccine, one thing that I saw was that there was a concern about infertility of the youth going forward. Have you heard anything that sort of substantially confirms that that is a concern for anyone at this point? Or is it just maybe a side effect that is very rare and uncommon?
Well, I've not actually heard of that being a long-term side effect of concern. What I will say is that in order for these vaccines to be approved for anyone, and certainly the younger groups, they are vetted very carefully by the FDA and the CDC before they are approved. So I've not heard about that as a specific consequence in terms of a large-scale concern. Certainly events happen, you know, across the board. We're talking about millions of people, but I've not heard of that being a major side effect, and consequently, the board of physicians or any of the other provider groups have not sent out any specific letter to address that as being a potential side effect or things to watch out for.
Okay, and that is, to me, the best news that we can hear right now, is that we don't have anything to substantiate that claim. So thank you for that. So here we go with a few questions in the chat. One says, what is the current mask requirements in Montgomery County? There's a CDC recommendation and the state mandate for indoors, but not clear on Montgomery County's required versus recommended for masks.
So right now, we're still requiring that masks be worn outdoors and indoors. As referenced, we followed the scientific experts, and in this case, it's the CDC. So now that the CDC has offered new guidelines, we will be adjusting our guidelines. And as I referenced, the county council sitting as Board of Health will be taking a new set of guidelines under consideration that will tweak that guidance and be consistent with what was put forward yesterday, in large part by the CDC. Now, I will also confirm, though, at the same time, indoor guidance in the state of Maryland, and so this is a little technical here, we cannot be less restrictive than the state's rules. Correct. So if the state has a rule in place, we can be more restrictive, but we can't be less restrictive than the state. And so right now, the state's rule is that unvaccinated and vaccinated individuals still must wear face coverings in indoor settings. Now, that's a little different from the CDC recommendation yesterday, but that is the current rule in Maryland. And from my understanding, the governor will not make any changes to that until we hit the 70% threshold that he talked about earlier this week. So hence our guidance is that, again, I won't go into detail because they will introduce the resolution, but suffice to say, we will make some tweaks to our county guidance to be consistent and in line with the CDC's recommendations yesterday related to outdoor face coverings. And as far as indoor face coverings, we still will follow the rule in place from the state.
And Dr. Gales, has anyone done the quick math to say when the state at the pace that it's on, it will hit the 70% threshold based on, where they've gone over the last week or so? If not, it's okay.
I don't know. I know they're mid-60s. I will say this, though. Part of the challenge will be the state overall is experiencing the same issue across the board, that there was a drop in terms of folks coming in to get the vaccines over the last several weeks.
Right.
And I know some of the smaller counties throughout the state are being hit hardest by that because they've pretty much vaccinated everybody there is to go. I mean, when you're a smaller population, there's only so many folks to get vaccinated, right, and in terms of moving the needle. So really, in this sense, this is an opportunity where residents of the larger jurisdictions, including our own, can have significant impact across the state, because the more folks we get vaccinated, that's going to move that state needle even more because we've got such huge pockets of population. So I would say if we want to hit it, kind of what we said in our briefing on Tuesday and Wednesday, this is really up to our residents. Folks get vaccinated, we increase the numbers, we increase the percentages, and we're able to open up more locally as well as on a state level.
Makes perfect sense. All right, next question here is about outdoor mask wearing. I run an outdoor business. With the CDC announcement yesterday, I expect lots of pushback from guests this weekend about my requirement that they use masks. Please clarify right now, does Montgomery County require mask use, and then it broke up, outdoors when not in large gatherings?
Do you want me to take that, Travis? So I think effective today at 5, there is no outdoor mask requirement either with CDC or the Maryland Department of Health. So there is no county requirement for outdoor mask usage at this time. And I know I asked the individual asking the question to provide what the nature of their business, and they said they were an aerial adventure park. I would assume that also for safety reasons, masks would not be a good idea in that business. And then another person indicated performing arts, and I don't know if that was also part of this question, but there'd be no requirement for a business to have their patrons wear masks outdoors while doing performing arts. With that said, a business can, of course, decide that they want to have their patrons use masks, but it's no longer a county requirement.
Yes, and I heard that also this morning. Businesses can still require mask wearing, and again, that falls along those same lines of still being cautious to get us across the finish line, making sure we don't stop our efforts too early and then see some sort of regression. Everyone just keep us moving forward. Next question is regarding younger children than those who are even being vaccinated right now. With vaccines not going to be approved for 2 to 11-year-olds anytime soon, does this impact how elementary age programs mask and distance requirements after we reach the 50% threshold?
Well, again, a lot of this is subject to state determinations as well as federal determinations as it relates to indoor activities. I think as Ms. Kinch pointed out, the outdoor ones have been clarified, will be clarified shortly. I think the indoor mask requirements will be subject to a host of things in terms of further guidance from the CDC related to those who are unvaccinated, as well as what the state rule will be. Right now, the state rule, again, is that everybody's got to wear a face covering indoors, regardless of your vaccination status. The approach that we've taken, or at least in my opinion, from a health perspective, I think it does, at least in the short term, until we can get more people vaccinated. I do think indoor settings represent a challenge for community transmission because we're in enclosed spaces, and the differentiation between, again, unvaccinated and vaccinated makes it tricky. So please stay tuned for that. Again, I will say this, I know that all of the school systems are working under the premise that they will be back in full capacity in the fall. And many of the summer programs, whether we're talking about camps or instructional type opportunities, are factoring in all of this information as it comes in. I recognize that and I'll say this, and it's not making an excuse, I recognize that the general public wants answers quickly, but we literally just got this announced last night in the afternoon and just actually got to see the official guidelines later in the evening. So we're constantly trying to work to pivot to update things as quickly as we can based upon, when that information is put out. I say all that to say that I do think, and we applaud our school systems, we applaud the businesses, we applaud everybody for having to be constantly nimble and flexible as we get new information dropped on us to be able to put the guidelines in place to make sure things can move forward safely.
Absolutely, I totally agree. Again, echo, thanking everyone. 2 quick questions, which I believe we have the answers for, and then one more follow up. One says, thank you for the information, but just to be clear, when MoCo aligns with the state, there will be no distancing requirement indoors, outdoors, including summer camps for students. And the answer is when we align with the state, we align with whatever the state is allowing at that time. So there will not be a difference. And I think that might be the first time that we've been aligned with the state from the very beginning when that happens, by the way. The next one is it okay for organizations to reinforce face coverings when the local and federal government loosens their restrictions? And the answer to that is yes. You can be more restrictive, but you can't be less restrictive in our guidance. And by the way, our guidance that we referenced earlier, do we believe that's going to come out maybe early next week online for us to provide to the business community in order what we believe should be recommended versus required as we go forward?
I believe so. I mean, I think we'll a lot of things will shift to recommended categories because, again, there's certain stuff that still carries risk. And again, particularly for individuals who are not vaccinated. And we're still talking about, and I don't want to say we are happy. Don't get me wrong. We're very happy to be hitting the levels that we're hitting and seeing 60 and 50%. But on the flip side, there's still a lot of people out there who are at risk of exposure, including our young people who aren't eligible for the vaccine, as well as a huge cadre of adults who are eligible for the vaccine, but for whatever reason are not getting vaccinated.
Right.
Or haven't been vaccinated to date.
Yeah, we still got to work on that and still got to get that up as much as possible. It doesn't stop here. All right. Last one says, my apologies for being late. Have you answered the question regarding tracking breakthrough infections for those fully vaccinated? And your answer, I believe, was that you believe the CDC is tracking that information, but more importantly, people who were getting one vaccine and not being fully vaccinated were showing up in larger numbers of people who were still being contracted with the virus. But if there's anything else you want to say to that, I think the person who asked the question is actually here now. Otherwise, we will wrap it up there.
No, I don't think there's much else to say. There's those three groups, but there's more breakthrough cases for the people who are not fully vaccinated, again, meaning that they've only received one dose compared to those who've been fully vaccinated. But the group, again, just to emphasize, the group that's seeing more cases are people who are not vaccinated. And that's the group that is a concern. So the more we can shrink that number of people, the greater weapon we have at driving the community transmission levels to low levels and keeping them that way as we move forward.
Okay, all right. I think that's all the questions. We'll thank you for being here, and to Dr. Gills and Ms. Kinch, you are great as always, and we appreciate your responses. While I have you here, Dr. Gills, let me just say one thing, well, a couple little things. The public feedback, some of the public feedback that you have gotten has been, in my opinion, very cruel and thoughtless. And, the advice and the leadership that you've provided Montgomery County over the time of this pandemic has been phenomenal. You have done an extremely good job. You've been very consistent. You've been transparent. You haven't hid, and you've been there every week and every time I think that the county has asked you to be. And the external praise is not something that public servants look for, and nor do we count on it. But internally, the gratitude from your colleagues, such as myself, and I know some others feel the same way, is that we want to thank you for everything that you've done, the strength you've shown, and how you've been able to communicate and keep your poise and just still represent Montgomery County at the highest level of professionalism, save lives at the same time, while dealing with other factors that were totally outside of your control. So if no one has told you lately, we greatly appreciate you and everything that you've done. Keep up the good work, and we're happy, and I'm extremely happy to call myself a colleague of yours in Montgomery County.
Thank you, Jerome. I can't express how much I appreciate that. And I appreciate and value being able to work together with everybody on the team and moving things forward. And again, to emphasize, part of that team also is not just us in the county government, it's also the community folks as well as our residents. I don't think it's an accident when you look at the numbers where we are compared to where other, and this isn't a judgment on other jurisdictions. Okay, I don't want to get misquoted by that, but
right.
But no, it's a testament to our residents, and I know it's been drastically difficult. And again, don't dismiss or don't want to come across as insensitive to the economic realities and the lived realities of all of the decisions we've had to make to keep people safe. And I'm hopeful that with all of the efforts that you and your team have led around economic revitalization and the different procedures and policies and programs that the elected officials are putting into place, both from the county executive as well as the county council, will be that boost and shot in the arm to get things moving again, to make sure that all of our businesses and communities are able to move forward and recover fully.
Absolutely. We totally agree, and thank you as well. Ms. Kinch, thank you as well. You know how I feel about you. You're phenomenal and always there as well, so that cannot be understated. So thank you both. We do appreciate you being here, and we appreciate your time.
Thank you. Take care. Stay safe.
Absolutely. You as well. All right, so now we are going to be joined by our Director of the Office of Procurement for Montgomery County. His name is Ash Shetty. Ash Shetty is one of the most progressive people that you're going to meet in Montgomery County leadership, from From day one that he joined us, he has been very forward thinking and always pushing the needle of trying to make us better. He has also been very open with our community advocates to listen and improve Montgomery County, and knowing that we still have a long way to go. But last year, Montgomery County spent over $1 billion, and the government spent in excess of $120 million of that with local small vendors, and $180 million went to minority vendors within the county. He's also been a part of introducing and implementing legislation for a local preference point for those businesses anchored in Montgomery County. He created a solicitation tracker that has improved transparency, that shows people who are doing business with the county where their project is or where their application is, which we know that, I believe it used to be called the black hole that it went into, and you didn't hear anything you didn't know. And that's not Montgomery County specific, that's sort of specific to government overall. So shining that light on vendors and the community's information is always helpful, so people can know where they are. And today he is joining us to talk about some of his more recent accomplishments, including a vendor innovation portal. So I want to welcome Mr. Shetty. Thank you for joining us, and I'm going to stop and turn it over to you, and let's hear about your vendor portal.
Yeah, thank you, Jerome. It's nice to be here, and I appreciate the forum to talk about something that my team and I are very proud of. So, over the course of the pandemic, it became very apparent to me that if access to county departments prior to the pandemic was somewhat limited, during the pandemic, it essentially evaporated completely. And not only because of the logistical challenges that COVID presented in that folks weren't able to just ride up to Rockville and meet with the different departments, but also the fact that the folks in these departments got very much preoccupied with dealing with the pandemic directly. Even the contracts folks in the departments were working on things like modifying their contracts or getting new contracts in place to deal with pandemic-related matters. Now, the first attempt at trying to increase this access was an event that I hope some of you had the chance to attend in December, which is when we hosted a virtual reverse trade show. The whole idea behind that was you'd have these sessions throughout the course of a day where, whether it's IT or fleet, you'd have the different departments that were doing procurements in that space. So for fleet, we had everybody from general services to the first responders, essentially talking about what they're going to need to buy, helping vendors interested in doing business with the county get their ducks in a row. And it was a great day. It had over 500 participants, and that information is actually all recorded and available now. So if you missed it, you can still catch it on our website, and it's on YouTube. And so this way you can listen to what those departments had said they were interested in buying over the course of the next year and a half, which, believe it or not, it's already been almost half a year since that taping, since that event. Now, on a more ongoing basis, and by the way, that reverse trade show was by any means a success, and something that I do intend to continue with, and I keep my fingers crossed that the next iteration of it will not have to be virtual only, although I do want it to always have a virtual aspect to it, so that folks who cannot attend in person are able to catch these things online and sort of move to a hybrid model, because I don't want to throw the baby with the bathwater when it comes to recovery. Now, as far as a more ongoing mechanism by which businesses can get in touch with county departments, I looked at what was out there. We sought inspiration from companies like Procter & Gamble that have always considered their vendors as part of their engine for innovation. They've always seen the vendor community as being a part of what gives them a competitive advantage. And the thought I had was, why not do the same for the vendors who work with Montgomery County, who want to work with Montgomery County? Why not create an opportunity for them to share with the departments what they are capable of bringing to the table. Now, a lot of folks, would approach me, especially prior to the pandemic, and talk about the various ideas you have. And I think that that's really interesting, but the truth of the matter is that the Office of Procurement does not make the selection decisions. Those are made by the subject matter experts in the using department. So if you want to talk about, a new type of roofing or a way to extend the life of roofing, that would be something that really the Department of General Services would look into. At best, what we would do is make sure that you were following all the processes, but we wouldn't be making those decisions. And so what I envisioned was a portal that allows vendors with innovative ideas to be able to introduce themselves to the appropriate departments. So if you are able to get into the vendor innovation portal, what you will notice is that besides asking for your own contact information, it immediately will take you into a space where it's looking for what your what departments you potentially work with. Another very cool tool here is that as you select the departments, it actually will allow you to look at what types of items those departments buy. So if you're like, I'm not fully sure what exactly the Department of Corrections procures or what alcohol beverage services procures, you can actually just click into it and you'll get a nice list of the types of things that they buy. And this way you can see whether what you're selling actually is in line with what they might be interested in. And of course, you can also directly link to their website, as you can see on the screen right now. But then once you've decided which departments you're interested in pursuing, and obviously your information will be relayed directly to those departments, to contacts in those departments, the next thing we would do is get a sense of what types of items you are trying to sell to the county. And I think my favorite aspect of this project has actually been where we ask vendors to tell us how their innovation is going to impact Montgomery County. We give you the opportunity to talk about how this innovation might bring more efficiency in terms of saving us time or other inputs that would go into something we currently do or use. We give you the opportunity to talk about how you might save us money, or more interestingly, how you might improve environmental impact. In other words, how your services or product may help create a greener future. And we even ask how your product or services may help reduce inequity in the community. And this could be pertaining to race, to orientation, to gender, but just a terrific opportunity for vendors to talk about how they can really help the county achieve its long-term strategic objectives. And then, finally, we give you the opportunity to attach your capability statements. And at that point, all that information that you would like to get in front of somebody in the county is parceled up nicely, and we can use that as a tool to facilitate communication. Now, a quick comment, and Jerome, I'll stop after that and see if you have any questions, or if any of the audience has any questions. The idea behind this tool, again, is not only a moment in time type of thing where you can reach out and be noticed. It's also where somewhere down the line, if we're looking for ideas that have to do with a greener economy, we can search this database of the different solicitations that we received. I say solicitations not in the traditional sense, but in the form of your capability statements that were sent to us. We can read through your ideas for how we could be doing better. And this just becomes another way for us to harness your ideas by creating essentially a vendor database of capabilities. So that is the mission and the purpose behind the Vendor Innovation Portal. It's brand new. We launched it this month, to coincide with Small Business Month. But in all honesty, it's already received tons of input. We've had dozens of folks already use that portal to introduce themselves to the various departments. So I'm glad to see the uptake on it already.
That's great, Ash. And I had written a few things down, and you touched on them because I was like, equity and climate. So Tiffany Ward and Adriana Hochberg would definitely be proud that we've been listening and paying attention to how to make sure those two very important items are in everything that we do. So I'm glad to hear that you had already had those in there. That's phenomenal. I think that, again, the tool is going to be great. And there's a few comments in here, and I want to first of all thank your team for posting and the websites in there. If you can look in the chat, the websites that were on the screen that when Director Shetty was going through, or in the chat if you need to use them, as well as how they were navigating while you were talking. That was excellent. First comment is similar to the solicitation tracker. The vendor innovation portal is an excellent tool / idea. I think it is a great tool to bring business owners closer to procurement opportunities. I love how there is a link to the agency website and the agency spend. Thank you. That was a great comment. Next question is, will you be able to get the VIP tool to allow the user to drill down to the details behind the descriptions on the link that allows the user to see the views, and then in parentheses it says agency spend?
It's an excellent idea. I mean, frankly, it's a great standalone idea. Even if it weren't part of the vendor innovation portal, I think allowing folks to drill down into departments they're interested in, I think it's a great idea. I think there is some back-end functionality that goes beyond what my office creates and maintains, but it is something that I'm very open to doing. And again, I've brought a very, I hate calling it private sector mentality to some of my work, but I don't see this happen very often in government, this attitude that perfect is the enemy of the good. Very often I will put something together and put it out there so that it can be used, so that it adds value in the moment. But then even as it is sitting out there, I'm constantly tweaking it on the back end to make sure that it does more. So I think that's a great suggestion. It's something that, like I said, I think would be a good idea, even if it were just removed from the vendor innovation portal, but just available to vendors as a resource. So yes, thank you for that suggestion. And it's something that we will continue to work towards.
Absolutely. And government being more efficient, more equitable, more transparent, those are all great things for you to bring to the table and keep us on our toes as we keep going forward. Remind me, Ash, Director Shetty, remind me the projections that have now been included or updated from, there we go. All right, yes. Okay, I hope everyone can see that. Again, where you view the projections, this right here is the closest thing we have right now to forecasting in our particular government spend. So please take advantage of that, business community, as he has gone through this presentation of information and how we continue to try to improve the customer experience that you have as we are definitely trying to move forward. We do have a question. I can't tell if it's a question or a comment, but let me read it and see. My company has done a lot of work in the county on the construction side, i.e. schools. How could we get more intimate with maintenance programs for HVAC or plumbing? Ash, I can email you directly if needed. Thanks for all your help. Chris Olone, Paramount Mechanical.
Yeah, no, definitely, happy to speak one-on-one. The one distinction that I do need to make, because this is a cause of some confusion, is when you think about doing work for the county, just know that MCPS in Montgomery College, they have their own procurement functions that actually we're part of one larger ecosystem for very obvious reasons. But very often I've had people reach out to me with questions or concerns about their dealings with one of those other entities, and frankly, all I could do as a courtesy is refer you to my counterpart there, but it's not something that I have a whole lot of influence over. But that said, again, happy to engage folks on one-on-one conversations and understand what opportunities we might have for the future. Just going back to that projections tool, by the way, which again, it's in the spirit of providing transparency to vendors. Those solicitations you see on there are what we expect to have, not what we already have on our solicitations page, which obviously means that they are actively being solicited. But the spirit behind it is simply helping the vendor community get their ducks in a row. You know, it's this idea that if you see something coming down the line, you can start preparing for it in terms of resource allocation, in terms of thinking about which subcontractors you might need for an opportunity of that nature, just getting yourself ready for an opportunity. And I think a lot of the empathy that we've tried to honestly harness as a core value of the department comes through in tools like that, right? One of the very first tools we had put up is the calendar of events, which was, again, designed to just help you understand what all opportunities are out there and plan your life to the extent possible, using a calendar that tells you, hey, there's going to be an open house on this date, or hey, there's going to be a pre-bid conference for such and such solicitation. Just help you get organized, because I realize that especially for small businesses that is a challenge, and to the extent that we can help you, that goes a long way.
Okay, absolutely. All right, I think we're down to our final question, so we'll get you out of here on this one, which I think is pretty simple. My company builds web portals for virtual events and hybrid events, also portals for online learning and continuing education. I would like to register to do business with the county. We are Silver Spring based, webcastproducers.com. I'm pretty sure there is a link to get them set up in our system for procurement opportunities.
Yep. So for a company like this, you would go to mcipcc.net. This is where you would get to register as a vendor if you have not already. Of course, you should use the vendor innovation portal, but remember, providing your information on the vendor innovation portal is not the same as being a registered vendor. So you've got mcipcc.net to be to register. And by the way, that registration is also helpful for those other entities I mentioned, like Montgomery College and MCTS, besides the county. But then once you've registered, I would recommend going to the VIP, the portal that we were talking about earlier, and flagging your services not only to the Department of Technology Services, but maybe even PIO, the Public Information Office. And these are the types of folks who would be interested in services that you are providing. And when the opportunity arises, you definitely will be somebody that we'll know we can reach out to.
Okay, and I see that your team has posted that link in the chat, so please take a look at it. Ash, I want to thank you. Your openness, your innovation, your communication, all of that has been a breath of fresh air to Montgomery County. I know a lot of people appreciate it, myself included. So for everything that you've done, we thank you. For everything that you will do, we look forward to it. But thank you for joining us today. Phenomenal presentation and lots of great information.
Thank you, Jerome. And at the expense of making this seem like a total love fest, thank you for the energy that you've brought. Thank you for your calmness under pressure, because we've been through more than a few moments in the last 2 years working together, but especially in the last year. So I want to thank you for everything that you do and have brought to Montgomery County government.
Well, I appreciate it. I try my best and love what I do. And also, let me not forget thanking your team for joining us as well. Grace and Bethany, we appreciate you as well. So everyone else, we want to thank you for joining us today. In about 2 weeks, which we would next be scheduled for a meeting, we do have a holiday weekend, so we will not meet on May 28th. The next meeting will either be on June 4th or June 11th, but we'll let you know well in advance. We will have a special guest host that day, so please tune in. It will be Judy Stevenson, our small business navigator. Hope a lot of you know her. She is so well respected. She eats, sleeps, and breathes small business success, so her passion is undeniable and it's going to be great. The focus of that meeting will be on women and the workplace, and I could not think of a better person to represent this conversation with this group on that day. So be on the lookout for more information from it, and please share the word so we can ensure that Judy has a great time, as I always do with this group, and we'll have updates from our doctors, and we'll make sure that we answer as many of your questions as we can. But thank you for joining us. Everyone be safe and have a great weekend.